I'm Dr. Sarah Eccles-Brown. Today we'll be discussing upper eyelid surgery, with bilateral upper lid blepharoplasty being the most commonly one performed. At the time of your preoperative visit, we will have you watch this video to better know what to expect before, during, and after surgery, as well as to gain a better understanding of the risks, benefits, and alternatives to surgery. As time goes on, the upper lids may begin to droop and block the upper part of your visual field. When this causes symptoms affecting your daily lifestyle, it may be time to consider surgery and see if you qualify. It is important to note there are no surgeries without risks. The main risks for upper eyelid surgery include pain, bleeding, infection, asymmetry, poor cosmesis, meaning you don't like how it looks, unattractive scarring, numbness or altered sensation, and inability to close the eyes all the way, with the eyes becoming dry and requiring drops and lubrication ointment. This is still uncommon. Anytime we operate near the eyes, we always note that there could be some risk to the eye itself with decrease or loss of vision, which is very rare. The underlying cause of visual obstruction may be related to drooping eyebrows, or the muscle that raises the eyelid may not work well. But the most common cause is extra eyelid skin. If one of these other eyelid causes are noted, we might recommend a different surgery. Surgery is the most definitive way to remove the skin blocking your view, improve your visual field, and let more light into your eyes. As a bonus, it tends to improve your overall appearance. Alternatives to surgery include observation, knowing the eyelids will likely continue to worsen over time, injection of botulinum toxin to create a chemical lid lift, and skin resurfacing techniques such as lasers, microdermabrasions, and peels. On the day of surgery, you will need to have a driver take you to and from the surgery center. At the surgery center, you will check in about an hour before the time of your scheduled surgery. This will allow time to bring you into the preoperative holding area, obtain vital signs and place an IV, verify your identity several times to ensure we are performing the correct surgery on the correct location and in the correct patient. And it also allows time for the paperwork to be completed and rechecked. I will use a thin marker to outline the area of skin to be removed, and the anesthesia team will give some medicine to make you very sleepy while your upper eyelids are giving numbing medicine. After you're awake again, the anesthesia team will make sure you're feeling comfortable and relaxed before we bring you back to the operating room. You should not have any sharp pain during your surgery. You may feel some pressure or tugging, and you may see the overhead lights from time to time, but this is normal and not a cause for concern. If you do notice pain, please let us know. There is plenty of pain medicine to go around. While in the operating room, you'll be laying down flat. The eyes and face will be cleaned with a betadine solution, and a sterile drape will be placed over the face. You'll notice bright overhead lights. It's very important to stay still during surgery and to keep your arms down. After surgery, we'll clean the face and apply ointment as well as a cold compress. You'll be taken back out to the holding area, and you should be able to go home soon with your driver. You should not make any big decisions or operate any heavy machinery following anesthesia. It's very important you do your job to heal well after your eyelid surgery. First of all, take it easy. No straining or heavy lifting heavier than 10 pounds for about 2 weeks. Be sure you do not rub your eyes. You don't want to break or dislodge your stitches. If you have any problems or concerns about this, please give us a call. However, if you notice just a little bit of oozing right after surgery, you should be able to apply a little bit of pressure and hold it for a while, and usually it will resolve on its own. Ideally, I would like you to wear eye protection for 2 weeks after surgery. You may wear regular glasses, sunglasses, or even construction glasses while awake, and be sure you do not rub your eyes while you're asleep. After your eyelid surgery, I want to see you back at 1 week so that we can remove any stitches that are not dissolvable. We will also see you back at 1 month after surgery. Believe it or not, your best friend after surgery will be a bag of frozen peas or frozen corn. This will conform nicely to the shape of your face, and cold compresses will help with the bruising and swelling those first few days. It's important to be aware it may look like you have 2 black eyes following surgery, and the bruising and swelling will usually get worse before it gets better. That is normal. By about 1 week, you should notice a significant improvement, but it still will not yet be back to normal. I would avoid scheduling your surgery around the time of any important events or photo opportunities where you would want to look your best. I hope this answers your questions, and hope knowing what to expect the day of surgery and in the following weeks will go a long way to easing your mind. Please feel free to call anytime with questions or concerns. I promise to do my very best for you, and the whole Elmquist Eye Group team is here to take care of you.